Hi, I'm Dr. Bernadette Riley, and I'm a professor of family medicine at NYIT-Com. I'm here to talk to you today about obesity. Obesity is a disease. It is not a lifestyle choice or due to lack of willpower. The two most commonly reported negative psychological effects related to weight loss are weight bias and negative self-esteem and body image. What is weight bias? Weight bias is when you're stigmatized based on your weight. It can lead to negative attitudes, judgments, and stereotypes in the workplace, in the healthcare field, or in a healthcare setting. It can lead patients who have obesity to avoid social situations or situations where they may be exposed to other people who could judge them or stereotype them. These feelings of shame or distress could either be due to their weight or habits related to weight. Up to 50% of patients report being stigmatized more than once about their weight by healthcare providers. This leads patients who are overweight or with obesity to avoid seeing their healthcare providers. Negative body image is a common symptom that's also seen in obesity, as is low self-esteem. Negative body image is dissatisfaction of one person's weight or body shape. Negative self-esteem can be seen and can cause a lot of emotional distress and disorders. One thing a patient could do if they feel that they have low self-esteem or negative body image would be to discuss with their healthcare providers these feelings. With their healthcare providers, they could come up with a team-based approach on how to help, especially when you're having these feelings during your weight loss journey. Anxiety and depression are both two psychological complaints that are seen a lot in patients who are obese or overweight. In fact, the PHQ-9, which is a screening tool for depression, asks the question about overeating. Overeating is a symptom in depression. There's up to a 55% increased risk of depression in patients who are obese. There's increased suicidal ideation, and an increased BMI has been shown to increase anxiety amongst patients. There's also reports that patients who have obesity have a worse sleep quality, which could perpetuate the symptoms of depression and anxiety. The low self-esteem and the stigma that can be associated with obesity and overweight can also lead to weight bias, depression, and it could affect every aspect of their life. This is why it's important to provide high-quality obesity care using evidence-based guidelines. As you can see, the relationship between obesity and depression and anxiety is prevalent. This can contribute to emotional eating, which can increase calories, especially for patients on a weight loss journey. The impact of depression and anxiety for patients can also affect every aspect of their daily life. If you think you're suffering from depression or anxiety, it's important to, first of all, bring up this problem to your healthcare provider and also look into behaviors that might suggest you may be having these problems so you know what to bring to your providers and talk about at your next visit. Eating disorders are also seen in patients who have obesity. Eating disorders such as nighttime eating syndrome, bulimia, and binge eating disorders are seen. In fact, 3 to 6 times, people with binge eating disorders are 3 to 6 times more likely to have obesity than those without an eating disorder. So it's important that patients who think they might be suffering from an eating disorder talk to their providers about their symptoms. If you're throwing up after eating or experiencing bulimia, that's also seen in up to 33% of patients who have obesity. BDD, or body dysmorphic disorder, is also seen where patients have a distorted image of their either body shape or their body weight. There is a relationship, as we spoke about, between being overweight or obese and having an eating disorder. Many times there's co-occurring conditions associated with eating disorders, including anxiety and depression. Eating disorders can impact a patient's daily life and can lead to long-term consequences. If you think you may have an eating disorder, it's important that you get help. Looking for signs such as disordered eating, excessive calories in limited amount of times are important to talk to your healthcare provider about. I see a lot of patients who try to improve their mental health, and they come to me asking, how can I improve my self-esteem and my depression? One thing that I recommend for patients who are overweight or obese, who want to lose weight, and who are struggling with a mental health issue is visualization, visualizing a goal, going with them on their journey, asking them to journal their emotions, going with them on this journey, and understanding things like mindfulness, encouraging meditation, discussing about how important it is for physical activity and how physical activity, and especially if you find your why or what you enjoy to do, you can do it with a friend or get support from therapists or other people. Going through CBT, cognitive behavioral therapy, oftentimes help patients with co-occurring anxiety or depression during their weight loss journey. Realizing that there's a team-based approach to their care also is something that I recommend. There's many resources available. For example, if you're suffering from depression and anxiety and you've reached out to your therapist and you have a team-based approach, there's also workbooks that you can do that could help you be mindful of the moment. There are benefits to getting treatment for your emotional health and your mental health while you're going through your weight loss journey, especially in patients who are overweight or obese. And these strategies can help you improve not only your emotional health, but also your physical health, and can also help with many co-occurring conditions, medical conditions that are seen in obesity.